And introduce yourself, gather your supplies, prepare your workspace, right? So one of your first order of business here, wipe down the table with sanitizer wipes as indicated, right? Which you should do. And then you're gonna perform your hand hygiene. All right. The soap. No. Okay, hand hygiene at work. So hand hygiene. So to take it off, right? We're not using the sterile gloves, right? We're using just clean gloves for this. Come in, introduce yourself. Hi, I'm Jim. I'm your nurse today. I'm going to be replacing your central line dressing. Looks like it's a little dirty here. As I'm looking at it, I'm assessing, right, for signs of infection. I've got my biodisc there. I've got a new one here, something I want to grab because not all the kits come with it. Here. So it's a central line. This would be a pick, could be a midline too. That's attached here. I've got these, and notice on these are all closed. So some of these dressings are pretty hard. So when you take your dressing off, when you remove it, so one of the things we need to do is mask too, right? So we're gonna mask our patient, we'll mask. If it's a central line like this, you have them turn their head. Do we have mask? Do we have a mask stand?
I got you.
Maybe the best place.
Dressing change.
Sterile, right?
So again, we take everything off with dirty gloves.
Oh,
We're
I
not,
see.
it is
Sorry,
sterile,
sorry.
yeah, when we actually clean and everything. But when we're removing things, what happens if we put on sterile gloves and we start doing this? I noticed there's some YouTube videos where some instructors are doing that, like, put your they set up their nice sterile field, they have everything, and then they put their sterile gloves on, and then they remove a dirty dressing. Makes no sense.
Yeah, it doesn't.
So like, am I missing something here?
Not only does it make no sense, it's not correct.
Oops.
Put your mask on.
This is why I don't like to be videotaped, because
Don't worry, I don't have your head in.
Yeah,
Something going on.
same here.
Okay.
It's zoomed in.
Because then,
Yeah.
like, we know that you're human.
Okay, so we've got a mask on our patient, right? We've got a mask on ourselves. We're looking at our dressing here. We're confirming the patient, we're confirming our order. And then when we start to remove this dressing, an important thing to think about is we want to make sure this doesn't migrate. So when you're changing these dressings, you want to hold some pressure against where the catheter is. All right. Does anybody know what this is? You seen that before?
Antimicrobial disc.
Yeah. So this is a biodisc. So it's important that we have a new one of these. It may or may not come in the kit, but we're going to replace this. Okay. There's also like a gelatinous version of it. That's like a little square that goes in there, and the same concept, right?
Some of the dressings have it built into the dressing too.
Yeah.
I'm a little confused because I'm reading
Yeah.
the checklist and it's actually saying
Open dressing using sterile.
to
Is
open
that when we're
the
just
kit
like opening
and
like
use sterile gloves to take it off, like you said we should.
So put on clean gloves, open dressing kit, use sterile technique, and don't mask.
Yeah.
And then
It
remove
says
all
don
dressing.
mask, and then it says take it off, and then it says don sterile gloves.
Does it make?
Further down.
Yeah. So
Yeah, I think
so
it's-
put on clean gloves, open dressing kit using sterile technique, and don mask, right?
open the kit using a sterile technique, not using gloves. There's a proper way of opening any sterile packaging
Yeah.
using clean gloves. You don't use
Like
sterile
when you
gloves
pull
to
the
open
package away,
Yeah.
away from the
So we haven't opened the package yet. We're just taking the dressing off, right?
Right.
So take off our biodisc. We're holding this. You see how this thing migrates?
Mm-hmm.
So we can just take this now. Take these off. hygiene. These kits, a lot of the time, they'll have like a sterile kit that'll look like a catheter kit. It'll be a long, like a drape, which you'll see often. They're typically not a little kit like this. They're bigger, they're a much larger one. So now we got this. So hand hygiene, right? And we can actually open this too.
Can you bring the kit up forward, Jim, so
Yeah.
they can see it? 'Cause I'll tell you that having watched a lot of people do this skill and skills testing, the issue is always the opening of this kit, the setting up of your sterile field, and,
Can you actually turn your whole body
Yeah.
around so that we can watch you do that?
yep.
Like so.
Wonderful, thank you so much.
Did you guys see how I used the 1 inch and did it like started and then away, right? So now I got these, and then I got gloves in here, right? And I did my hand hygiene. Do that, and now we got these.
So you can reach in with your clean hands to remove the gloves. But if you go in there like you're reaching into a bag of potato chips and just starts reaching around and touching things, the gloves are on top for a reason. You need to be careful about removing the gloves with your clean hands.
And also in the nicer kits, they're better gloves. And these kits, these are terrible. It's what we have to work with, but they might not accommodate your size either. So you might need to grab another size that fits your hand type. The other thing is, right, we're doing this, which we're breaking sterile field, right? It's out of our way.
I know that was something wrong with the wheel.
Below your waist.
Keeping it all in view is important, but for demonstration purposes.
Let's pretend it's
Yeah.
up here.
Let me open this. Because I'm doing it in front of everybody, these are gonna rip and they're not the right size.
Do you wanna lower it?
But sometimes you
Not
just
gonna get it open my-
push through and see what happens. Yeah, these are way too small. And this is gonna happen to you when you test.
Yes. Hopefully they'll have some extra large around.
Yeah. Not for me though, on this one.
All right.
Did it.
I don't need this, right? I could use this if I'm drawing blood. And if anything falls on this, this is sterile, right? I got this, so here's my, make sure I got all my supplies, got my dressing. You don't necessarily have to do this, but I'll show you. Okay. So you notice in your kit, you guys have a dressing here, right? You've got this Q-tip looking thing that's in here. This guy. You've got chlorhexidine, and we've checked allergies, right, to make sure they don't have a chlorhexidine allergy, in which case we would use
Iodine.
iodine, yeah. Or alcohol, right? They might be allergic to all the above. So that's that. We've got some tape here, and we can use the tape. I'll show you in a second to do something. And we've got our tweezers.
And you'll have a chlorhexidine impregnated disc too.
And there should be, oh yeah, there should be this guy, which is a little 2x2, which is helpful. All right, so now with these, you got to break them. You guys remember how to do that? And so you'll lift these up. This thing migrates. It's kind of a pain. So you're going to scrub. You're going to scrub. And you want to go past the outside of where the dressing was. Back and forth, right?
So Jim, is there like a direction like you from the inner to outside or not?
What's that?
When you clean, do you need to clean from the inside
You don't want to do a circular motion, back and like a hashtag, back and forth, up here, back and forth, back and forth. Did you guys see how I did that? Back and forth, and then this way, back and forth. What you don't want to do is have these tips hit this, because then it's not sterile anymore, so you're using these little Q-tip things. So when you're done with the outside, you can clean this depending on where it's at, right? You kind of clean the outside. Then you can take your wipe and clean these.
You could potentially.
And if I had a garbage here, I'd drop that in my garbage.
Could you potentially put that sterile cloth underneath and do it that way if you don't wanna hold the lumens?
If I did what?
That sterile cloth, could you potentially put that underneath them instead of holding your lumens?
Yeah, I mean I could.
Okay.
But I want to hold it because I want to clean the lumens.
Got it, okay.
Yeah. And this came out this nice.
No.
So then I would go back.
Not part of it.
So then I would go back and clean these really well. I hope this doesn't happen in real life.
If it does, there's a problem.
There's a problem. Okay, so I'm gonna clean this. Did you see how I took the chlorhexidine and I cleaned the backside of this thing? You'll see in a lot of these videos that they don't do that. They just leave it up against the nasty skin. So you got your 2x2, you're still sterile, right? So you can take it, clean the back of it, and then clean your lumens really good, best you can. Some of the kits have 3 of the chlorhexidine, like Q-tip things, some garbage. And then my next step, I need my bio patch,
That's right there.
which is here in my kit.
It suddenly appeared.
Suddenly appeared.
You can use your hand with that. You're okay to do that.
Yeah.
Yeah.
So we also need to let this dry, right? How long are we gonna let it dry for after we clean it?
30 seconds.
30 seconds, right? So now we've replaced the disc. You can push that back into here. Can you pull it? Okay. Now it's still sterile because I haven't touched the inside of it. Now we can take this. And this doesn't really matter the way that you just want to cover it good. And I typically go from the center, kind of seal it like so.
Try to avoid large air pockets. Which is one reason to start from the middle and go out when you're pressing the dressing.
And the chlorhexidine on these mannequins, I was very liberal with it, so you probably don't want to do that much because it's going to make it really hard to stick. Just FYI. I just found that out.
For practice, especially if you want to do it multiple times, just don't crack the wand. Just keep it dry. You can crack it for real when you test, but just so that you can practice that motion. Just keep it dry.
And so yeah, you want to do the center in here, and then you just go out. And then you would save this section, right? Initials, date, and time. And you would put it there.
Oh, yeah. I didn't realize there was a little thing on there. That's cool.
Now, I mean, you're not sterile anymore, you don't need to be, right? So if you need to clean these additionally, you can go back with some additional chlorhexidine if it's really nasty and clean these. The point is you really want to get those lines clean as you can, right? And you might even need some additional like cleaning materials that aren't in there. So preemptively, that's why you look at it, assess it. Yeah.
The Q-tip that you were using, did
Yeah.
it actually have chlorhexidine on it?
I don't know if this
The-
one does.
You threw it
Oh,
in
yeah, I
the
did.
garbage.
What it says on the thing.
But that's what you were doing with it, was going around and cleaning those.
Yeah,
Okay.
yeah.
What were you gonna do with the
It's an antiseptic applicator in the kit. There was no antiseptic in it though. Usually it's in like a sealed little pouch and you break it off and it's like sitting in the solution. So I don't know why these don't have it, but that's, in the real world, that's what they have, yeah.
What were you gonna do with the tape?
Oh, I didn't show you that. Sometimes the tape is these lumens are really long. So what you can do, you can take your tweezers, right? And if these are in the way, you know, depending on, you have 2, 3, it's taped now. But if they're untaped and you're trying to clean it and these keep falling down, you can actually tape it up over the shoulder, right? And out of the way. And then you can really, or if you have to turn so they don't fall down, you can tape it. it's up to you if you want to do that or not. It's not in the checklist. Yeah. Questions?
I'd like to show you how you would take a CHD disc or any